Hi, I'm Dr. Matt Wiederholz. I'm with Performance Pain and Sports Medicine in Houston, Texas. I actually started my practice, Performance Spine and Sports Medicine, up in New Jersey, and we have several locations there. I trained at Baylor College of Medicine in Houston, Texas, and then had gone off to fellowship in Georgia at Non-Surgical Orthopedics. That was back in the Passer days, the physiatry fellowships. And then I started a practice up in New Jersey and have expanded that, and now have partnered with another doc down in Houston, and we named it Performance Pain and Sports Medicine. And we specialize in interventional pain management, sports medicine, and we have physical therapy, chiropractic, acupuncture. We try to incorporate a lot of different non-surgical modalities into the comprehensive management of pain. And I think one of the things I wanted to just point out was the importance of being a member of these various pain societies, particularly ASIP. I think ASIP does a really nice job advocating for pain doctors and pain patients, for that matter, as well. I was asked by EpiMed and ASIP to head up to Washington for a lobbying event that ASIP had done last year, 2016, specifically addressing two main things. One is the coverage for lysis of adhesions or epidural adhesiolysis, as there is not a national coverage determination for adhesiolysis. I'm fortunate that I practice in Texas and we do have a local coverage determination, so lysis is universally covered by all Medicare plans in Texas. However, there are other locations, other states where the Medicare Advantage plans, which are run by various commercial carriers, are denying the procedure, despite it being a universally covered procedure by traditional Medicare. So we went to Washington to lobby various senators and congressmen on behalf of pain physicians through ASIP for coverage of this procedure. The other thing that we were bringing to their attention was the passage of MACRA, the Medicare Access and CHIP Reauthorization Act. MACRA requires significant reporting by physicians and physician practices, and if that reporting is not done, then there are penalties, upwards of close to 20% payment cuts over multiple years that will significantly affect reimbursement for physicians. Now, what's the problem with that, and why was ASIP so concerned about MACRA? The reason is most pain physicians are either solo practitioners or small group practices, and it's very challenging to have the infrastructure to do all the reporting if you're a solo practitioner or a small group practice. Essentially, the burden falls on the physician, him or herself. Whereas if I'm employed by a large hospital network, there are systems in place to do that reporting for you. And so the incentive that, this false incentive that it seems is present with MACRA will favor those who are employed by hospitals. And so it's causing pain physicians to close their doors and become hospital employees. And that's going to significantly prevent access to good quality pain management services, and so ultimately it's the patients who suffer. So I wanted to just stress, and this is something that I think EpiMed has done a great job partnering with ASIP. If ASIP asks for your voice, I think it's important that you step up and you provide that voice. Yes, it means taking a day or two away from your practice. It's going to cost you some lost revenue to do that, but ultimately, if we don't speak up, then these sorts of implementations just simply occur. And it's important that pain physicians speak up and help ASIP in this process. The meetings, I believe, were all coordinated by ASIP directly, and so I had strategic senators and congressmen that I was meeting with, and it was very well received. The vast majority of them were quite concerned about MACRA. They had heard from various other specialties about their concerns and patient access being the main issue. They were slightly unaware of the issues surrounding epidural adhesiolysis. Most obviously didn't even know what the procedure was, and so it was a bit of a learning curve trying to educate them on the procedure. But if you simplify it and basically say this is a procedure to help patients with chronic pain, and this resolves many of those issues that those folks are suffering from, they get it. And when they hear that Medicare Advantage plans are not following Medicare guidelines, that's a problem. I would most certainly go again if asked by ACIP. I think, but I do think it's important for others to step up as well. I think that's one of the things that LACS at ACIP has stressed. They've seen him, they know him. It's a repetitive message. They need to see more faces. They need to see other folks coming in and hear those voices, and preferably more than just one or two representatives from each state. If you've got a group of physicians for each state, I think it's even more powerful, the message. And so I think ACIP will continue their efforts as far as lobbying is concerned. And I know, they have a separate lobbying fund. You have your ACIP membership dues and then a lobbying fund. And other specialties that have had tremendous success in expanding their scope of practice and maintaining reimbursements are the specialties that do a lot of lobbying. Look at chiropractors, look at nurse anesthetists. They spend a ton of money on lobbying, and chiropractors in various states have expanded their scope of practice tremendously and to their benefit. And so I think the same holds true for physicians, but physicians get busy and they find it challenging to leave the practice in order to do these sorts of things. And if that's the case, that's fine. Then donate to the Super PAC so that those of us who attend these events are able to actually get the work done. 2017 is technically the rollout of MACRA, so the reporting theoretically begins this year. The penalties don't kick in until a year later, is my understanding. What many of the staffers at these senator and congressman offices have portrayed to us was that there likely will be a delay in that implementation because, like all things that are new, there's going to be confusion surrounding it and how do we comply with all these various metrics. And particularly, they chose a year. There's a change in administration. There's a change in the party. I think there's going to be substantial changes to that law, hopefully. I certainly don't agree that the law is a cost-saving measure. If care is funneled to the hospital, it's more expensive. If I do an injection in my office, it's way less expensive than at the hospital. If I do an injection at a surgical center, an outpatient surgical center that's private, that's less expensive than taking that care to the hospital. So even though you're penalizing those who are in private practice by forcing everyone into the same requirement metrics, you're driving that care into a more expensive hospital system. So it's hard for me to grasp how that actually equals cost savings. In addition, they've taken the cuts that they're making to certain physician payments and they're incentivizing others, and it's theoretically a cost-neutral platform. So again, I don't see how that saves money. I think by driving the care to the hospital, you're already increasing total cost, and then with the various cuts and incentives, you're just shifting who gets paid more, and it's a favoritism to those doctors who decided to become hospital employees. But the American Hospital Association is a great lobbying organization, as are the insurance carriers. And so they get things done. If I were the hospital administrators, I'd be happy that our efforts paid off. We got the care to be funneled towards the hospitals. And so it's this battle, and if we as private physicians, and ASIP represents these private physicians, if we don't fight, then we don't have a voice. So you have to keep supporting them.